Hi everyone, I am Dr. Subash, Consultant-Cardiac Anesthesiology in KIMS Hospital, Trivandrum. There are a lot of misconceptions among the common people when they come for any cardiac surgery or thoracic surgery. The common fear being whether they can undergo a complex cardiac surgery easily or whether they will have a post-operative pain when the surgery gets over. I would like to stress here that the cardiac anesthesiologists are extremely important in the current era of cardiac surgery. In KIMSHEALTH, we have a dedicated team of cardiac anesthesiologists who do a proper preoperative assessment once a patient gets admitted prior to the surgery. We explain the patient and their family members about the surgery, about the type of anesthesia we are going to administer, about the risk involved, about the post-operative course, and how well we are prepared to tackle the risk if at all we come across anything. Altogether, we prepare the patient and the family members mentally before they have to undergo this complex cardiac surgical procedures.
So the surgery here is done under general anesthesia. General anesthesia is a state similar to unconsciousness where you will not be aware of anything. So once you're taken into the operation theatre, general anesthesia will be induced and the surgery will progress. So during the surgery, we need to monitor the function of your heart. So this is used using a special echo probe called a transesophageal echo probe. This is inserted through your mouth and it will monitor the function of the heart. You will not be feeling anything since you are already under anesthesia. So this probe will monitor the pumping function of the heart, any valves which are leaking. So all these parameters will be used to guide the surgery. So after the surgery, you will be shifted to our post-operative ICU. At that time, you will still be on ventilator. You will be monitored round the clock. So usually we extubate the patient, that is remove the patient from ventilator on the same day.
Hi, I'm Dr. Haridas, Trivandrum KIMSHEALTH. I'm working as an associate consultant in cardiac anesthesia. So regarding the pain management in cardiac surgery as well as lung surgery, we offer a comprehensive pain management. So basically we assess the pain of the patient in a pain score and we give medicines as a multi-modal analgesia. So this include opioids, NSAIDs as well as regional blocks. So as you all know that lung surgery, we put an incision over the chest. So it can be painful. But we do take care of that with the help of regional blocks. So this include erector spinae block, paravertebral blocks. So the advantages of putting a regional block is that we can introduce a catheter through which you can actually introduce medicines. So even after the surgery, you are devoid of pain. So this mainly focuses on early ambulation, which improves the respiratory function of the patient. So never ever fear about pain in KIMSHEALTH.
As a part of cardiac anesthesia team, we are also involved in initiation and maintenance of ECMO, that is VA/VV ECMO, and also most importantly initiation of ECPR, in which we were able to resuscitate a lot of number of patients.
I'm Dr. Swapna, consultant in the Department of Cardiac Anesthesia. At KIMSHEALTH, we have a heart team which involves mainly the cardiac surgeons, the cardiologists and the cardiac anesthetists. And as a team, we are providing state-of-the-art care for complex cardiac surgeries and also for cath lab interventions.